If you have severe back spasm or pain or knee pain, you've come to the right place. This is Dr. Lin with Embodiment Physical Therapy, and today I want to talk to you about the idea of stop going to urgent care and start going to this instead. Of the patients that we've heard from that have called us because of a spasm, a severe back spasm or severe pain that they can't stand any longer, and that they end up going to the urgent care, and the kind of things that they've been given at the urgent care and discharged with blows my mind of why they're doing this thing. So the other day, one of our patients called and asked for PT because he tweaked his back trying to lift a garage door. So this was an urgent situation that he was dealing with because he had a back spasm, and he went to urgent care thereafter, and they gave him meds, x-rays, and that's it. That's all he was given with. I don't know why the urgent care does not give him a referral to see a physical therapist, because we would have done a lot more for that person than what the urgent care would have done. We see this all the time. The fact that the pain pills is going to mask your pain. It's not going to it's not going to solve the root cause of that problem. Because that person was on a 6-week medication, 4 to 6 weeks. And they had to suffer for that much longer before they went to see the doctor, and the doctor prescribed a PT. When in fact, should the urgent care had this prescribed and refer them to PT, they would have suffered. They would not have to suffer 4 to 6 more weeks and go through that emotional trauma of thinking that this medication is going to solve their problem. Now it's created more frustration because it's masked, that pain pill has masked their pain, and now they're out there doing the things that they used to do, thinking that this isn't a problem by taking this pill. Only when they stop taking this, and when this medication wears off and this back pain came back with a vengeance, 2 to 3 times worse than it had, now are they confused, frustrated, angry, and depressed of where this pain just came from. I know it, they don't. And the level of frustration for that person has gone through the roof. So if you have back pains, or if you lift a garage or do something and it's in severe spasm, don't go to urgent care, because they're not going to solve your problem. Go to a physical therapist and get it looked at. You don't need a script sometimes to see a physical therapist, so that they can triage that issue for you on your behalf, give you some hands-on treatments, give you some self-care stuff that you can start immediately doing at home and stop masking your pain, so you can start feeling better. So that 4 to 6 weeks from now, you can get back to doing the things you really want to do, as opposed to masking it for 4 to 6 weeks by taking these medications. Blows my mind that they don't prescribe this kind of stuff that actually helps. So you've got to be educated and be more informed. If you kind of had a back spasm or a neck spasm, if you woke up the morning of and your neck is tight that you've got a headache and you can't focus, go see a physical therapist so that they can get to the bottom of this. Because we see this all the time. And we'll be able to kind of get you moving in the right direction on the same day, if you're able to do so. Yes, you'll get some relief with the pain meds. If you need to do that, by all means. But the next thing I would do while you're taking the meds and you're trying to get back in the swing of things is to get help and get to the bottom of this and not sit on this for the next 4 to 6 weeks, which they're being told is to rest. Sometimes with the best intentions. But rest. Most people think that rest would help. Yes, it will, to some extent. Time, rest, and time doesn't solve everything. Rest with the right intention and exercise will get you over the hump. I spoke with a lady who downloaded one of our knee pain ebooks. Her name is Jill, and she's from Connecticut. She fell on both of her knees, and it's been more than 3 months. She's frustrated by the fact that it hasn't healed, and she's rested, and that it's taken this amount of time, and it hasn't recovered. So rest and time doesn't necessarily mean it will heal. I think most people get frustrated when they're being told to rest and that this thing will heal. And then when it doesn't, you go back to the doctor and get more medications or injections or more diagnostic of MRIs. But there's no treatment of the root cause of your issue or to get to the bottom of this. It's frustrating to kind of hear that from some of our patients who are frustrated because of the lack of why is this happening? What's going on? Why is it not getting better? It's been so long. So time without intervention, without the right intervention, isn't going to heal. It's rest with the right intervention is what's going to get you to where you need to be, to get your mobility, to get your independence back, so you can do the things you want and live life so you can stop feeling depressed, down, angry. Because you shouldn't have to live this way. So anytime you've got that kind of spasm in your neck and your back, or a pain that you can't bear, yes, go to the urgent care, but also see a physical therapist. This is something that we do in triage on a day in and out basis. And that rest and pain medications, prescribing rest and pain medications is not the answer. It'll kind of minimize, it'll take down your pain a little bit, but it's not, if you want to get the root cause of your problem solved, you need to do something about it. Medication is a passive way of triaging something. Yes, there's a time and a place for that. But most of the issues needs to be triaged and get to the bottom of this to kind of solve the problem as opposed to treat the symptoms.